Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 40 new cases of COVID-19 in Windsor and Essex County. 13 are close contacts of confirmed cases, 14 are community acquired, and 12 are still being investigated. We have had 15,676 cases since the beginning of the pandemic. 367 people are active at this time, and approximately 44% of our active cases have the variant. 1,052 preliminary or confirmed variants of concern have been identified in Windsor-Essex County, with 91% of these cases having the UK variant. 2 cases have the South African variant and 3 cases have the Brazilian variant. 11 people from Windsor-Essex County are currently in the hospital and 5 people are in ICU. Our community has lost 414 people to COVID-19 since the beginning of the pandemic. There are currently 9 active outbreaks in Windsor and Essex County, 7 workplaces, 1 long-term care, and 1 community outbreak. Regarding the vaccine rollout, 179,702 doses of a COVID-19 vaccine have been administered to Windsor-Essex County residents. 165,627 people have received at least 1 dose. Windsor-Essex County residents 18 years of age and older living in a hotspot postal code are able to book at 3 of our vaccination sites, Windsor Hall, the Moy Clinic, and Nature Fresh Recreational Center in Leamington. All 3 of these sites are located within hotspot postal codes. The postal codes include N8X, N8Y, N9A, N9B, N9C, N8H, and N9Y. Yesterday, the Ministry of Health announced pharmacy pilot sites using the Moderna vaccine. We are happy to confirm that Windsor-Essex is part of this strategy, and 14 pharmacies located in the hotspot area codes will be participating in offering the vaccine to those 18 years of age and older living in the hotspot areas for the next 3 weeks. We will be updating our website with additional information. The age limit across all vaccination sites is 50 years of age and older. This is for the general public and those living outside of the hotspots. Please visit wevax.ca or call 226-773-2200 to book your appointment. Please note that those in the first group of frontline essential workers who cannot work from home are now able to book their vaccine appointment. These are frontline workers who cannot work from home, those with public-facing roles or must work in person to deliver essential goods and services, and where protective measures such as maintaining a 2-meter distance from others is not possible. This does not include workers that are mostly working from home or virtually. And the complete list is on our website, and I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us this morning. Yesterday, we talked about the vaccine effectiveness and how the mass vaccine rollout in Windsor-Essex County is probably contributing to the lower case rates in our region. Public Health Ontario released the data on confirmed cases of COVID-19 following vaccination in Ontario, and I want to share that provincial data today to provide additional confidence in the effectiveness of these vaccines and how delaying the second dose resulted in population health benefit without putting anyone at risk. It all goes down to the basic vaccine science that the initial dose triggers an immune response, and the second dose or booster dose increases the duration of immunity. I'll jump right into the presentation now. So before we start the presentation, just a quick definitions on how the calculation have been done. So we can define individuals who have received vaccine and developed the disease under 3 categories. So first one is cases that has not yet been protected from vaccination. And this happens in individuals if they, after receiving their vaccine, they develop symptoms with less than 14 days after receiving their first dose of vaccine. So in other words, they are not even protected from the from COVID the body didn't even had a chance to develop an immune response in the first 14 days, and the exposure probably happened even before they got their vaccine. So those are the group that's more vulnerable, and that's why we always say that the moment you got the vaccine, it doesn't work that way that you're protected. You still have to give enough time to your body to build that immunity before your body can fight off the virus. The second category is the partially vaccinated case, which we know that most of these vaccines are 2 doses vaccine. So if someone has received a vaccine, just 1 dose, and if the symptom onset happened after 14 days after receiving the first dose, or any time before they received the second dose up until under 7 days after receiving the second dose. So those would be the criteria which we'll use as the partially vaccinated group. And then the third category that was used is the breakthrough or cases, which has occurred in individuals that are fully vaccinated. And we considered, or the data considered those individuals if the symptom onset happened 7 or more days following the receipt of the second dose. So technically, by that time, we should assume that the body had enough time to generate the immune response. And if despite that, if a case happened, that would be regarded as a breakthrough case or a vaccine failure, however we want to define it. So this is what the data looks like. And if we're looking, so this is showing all the confirmed symptomatic post-vaccination cases of COVID-19 by number of days between dose administration and symptom onset. The largest group that you can see here is the cases that happen in individuals after receiving the vaccine is in the yellow shade. And in the yellow shade, basically that means that these are the individuals who are not even yet protected from the vaccination because they developed the symptoms within their 14 days of receiving their first dose, which clearly understandable that the body didn't even have the chance to trigger that immune response. The second largest group that you can see here is in the green shade, which is individuals who have developed symptoms after receiving their COVID vaccine between 14 days or up to 28 days of duration, and they develop the disease. So it still triggers that there may be some individuals who take an additional time to build that immune reaction or immune response to the vaccine and to be fully protected. And then you go on further for in those individuals that develop the disease after 28 days of receiving the vaccine, all the way up to individuals who have either received their second dose of the vaccine, and then that number starts to go down in the lighter shade of blue. So this breaks down the data of in terms of the percentages and the number that after receiving the vaccine, what happened, how many cases we have seen in the entire province, and what proportion of these cases we have seen among all those who have been vaccinated. So when we are looking at number of post-vaccinated cases after vaccination, that total number is 6,726. But as we have mentioned before, there are more than 4,500 people who are not yet protected. So most of these cases happen in those individuals that were not even protected. So if we remove that one, then we are left with two categories. One is partially vaccinated. That means individuals who have received just 1 dose, and any time between 14 days up until the time that they are due for their second dose. And then very few cases which would be classified as a breakthrough case, that's 7 days after dose 2. In terms of putting all those perspective into the percentages or proportion of cases that actually develop, we can look at our total number of people that were vaccinated during that timeline of analysis, which is 3.4 million people. And out of these 3.4 million people, we have only seen the cases in individuals who are partially vaccinated, that individuals who have received only 1 dose. The percentage is 0.06%, which is very, very low compared to what we are seeing. Or in other words, we can say only 6 individuals out of 10,000 people after receiving the vaccine actually end up in developing the disease, which is, from a vaccine effectiveness perspective, it's pretty good because none of these vaccines are 100% protected. And from that analogy, this is fairly good, even individuals who have received their first dose. When it comes to individuals who have developed the disease even after receiving the second dose, that is 0.01%, or 1 out of 10,000 people who have actually gone on to develop the disease after receiving the second dose. And there could be a number of reasons for that, maybe individual differences, immunity, and how the body responds to that. But from a broader vaccine effectiveness perspective, that number is minuscule in terms of what you would expect to see from most of these vaccines that are currently available. So overall, based on this data, it is clear that the vaccinations are providing the appropriate benefit in preventing many of these cases. And even if when cases were developed in people who received the vaccine, the number is so low that it doesn't even measure in any ways from a vaccine effectiveness perspective. And as I mentioned in the last slide, when you're looking at the cases, so however many cases that is developed, the 67% of these cases, basically, they've never even had the chance, their body never even had the chance to develop an immune response. So we are only talking about up to 33% of these cases that ended up in developing the disease after receiving their vaccination in that category. Additional data with respect to the vaccine effectiveness in terms of hospitalization and fatalities among partially vaccinated or breakthrough cases. And then what we have done is we put in the hospitalization category and then identified individuals who are partially vaccinated versus the fatalities that we have been seeing, or people died as a result of these breakthrough cases or partially vaccinated cases. So I'll touch on the fatalities first. So clearly we can see that in individuals who were fully vaccinated or with 2 doses, there was no fatalities that was observed. So which is a great success that you can see and tell that among all those individuals, the vaccine was effective in preventing any severe outcomes or prevented people from dying. Among individuals that are partially vaccinated with vaccinated cases, the number varies. And again, it's a function of the age as well. And we can see in the seniors, 80 plus, 38 people who are fully vaccinated, who are partially vaccinated. Unfortunately, after contracting the disease, they died. And when it comes to the hospitalization piece, the similar trend, function of age again, and we can see that individuals who are fully vaccinated, and when the way we are classified the breakthrough cases, it happened more in seniors, 80 plus, and then between the ages of 65 and 79, and then individuals who were admitted and were partially vaccinated, that number is slightly higher, which is understandable given the number of cases that we have seen. But overall, even the vaccine failure, if you want to call it, these cases or people who have received the vaccine and still gone to develop the disease and ended up in hospitalization and fatality, from a proportion perspective, out of all those people who developed COVID, which is 6,726, only 2.3% of these people ended up in, who are partially vaccinated, ended up in hospitalization, which is, again, that means 97% of these individuals were cases did not result in any severe disease after even receiving receiving partially vaccination. And then the breakthrough cases obviously is very limited, and same with fatalities. So it's very effective in even preventing some of these fatalities. So I'll stop here, and I know some of this data and information can be confusing. I tried my best to lay down as possible in simple terms to give more confidence in people who are either questioning the effectiveness of this vaccine or questioning the decision from NACI to delay the second dose up to certain time. So hopefully with this data, it should be reassuring to many of us that overall population benefits has clearly outweighs the risk of people getting the vaccine and with a delayed and or an extended interval. And still there's an opportunity for people who are thinking about getting the vaccine My advice is to get the vaccine as quickly as possible to make sure that you are protected and you're protecting yourself and all your family members. Thank you.
We'll now take questions from the media. Today we'll start with CTV.
Yes, good morning. Just have a couple questions about the presentation. So the last slide you're talking about the fatalities in partially vaccinated cases. So does that mean, I just want to get a picture for Windsor-Essex, does that mean that there were 49 people in Windsor-Essex that died while partially vaccinated?
So just a clarification, this is the provincial data. This is not Windsor-Essex data. So none of this data is local data. This is all a provincial data. We haven't gone down to the analysis of doing it, an analysis at a local level. And just because the numbers are not that high locally, and pulling this data from all the health region, that makes sense, and that's what this data is represented. So my apologies if it was not clear. This is all the data that I've presented. This is all provincial data, province of Ontario, and include all the health units in the province.
So you don't know when you will get the information just for this area?
And not at this time, no. We and maybe that number could be very low to even present that because of privacy and other concerns. And but we can definitely look into the possibility of trying to do the data cut for our local region.
Okay, that makes more sense. Moving on to the announcement yesterday that some Windsor-Essex pharmacies will be administering the Moderna vaccine. Do you have any idea how many and where those pharmacies will be?
So there are 14 pharmacies that will be located in the hotspot postal code areas, and we will put that information on our website. But right now, I'm not aware of the actual confirmed pharmacies that are participating, but we'll get that up on our website as soon as we can. But they will be located specifically in the hotspot postal code areas and will be for people 18 years of age and older.
Okay, and now that more groups are eligible, how is the booking system handling all of the vaccination appointments?
So we just opened up this morning for the essential workers. So the call center is extremely busy, but as we open up new spots, they're getting filled. And so the booking system right now, like the online booking system, is handling the bookings. And I believe it's the call center that are probably getting many calls about the the booking for the essential workers, but all of this is online and it gives a good overview of all of those who are eligible for vaccination.
Do you have any updates on the possibility of mobile clinics or pop-up clinics at workplaces?
At this time, we are not planning on doing mobile or pop-up clinics at workplaces. That is something that others, in the Toronto area have done based on workplaces in hotspot areas. And we have not, planned on that. If there are any workplaces, it would be at a later time when it was open to the general, like when all categories are open and able to work with workplaces if needed. But we don't have anything confirmed. And right now, with the lowering of the age groups and the expanding of other groups, we are really focusing all of our resources on the mass vaccination sites, primary care providers, and pharmacy rollout.
Okay. And I know that we've asked this before, but have you heard anything more about the Canadian essential workers being able to get vaccinated in Michigan?
Turn that over to Dr. Ahmed.
So most of these workers who are crossing the border have been offered vaccination at their place of employment for the most part. We just don't have the data and information on that. But the dialogue to open it up for more people, I think that's still ongoing. And I will share the information as soon as I have some, but at this time, I'll just say that there's work happening on the background, and we'll share the details at an appropriate time.
Okay, thank you.
Any questions from CBC?
Yes, good morning. Doctor, thanks so much for your presentation today. You mentioned that you provided this data to reassure people who might have doubts about the NACI guidance regarding the 4-month delay or the effectiveness of vaccines in general. I wonder how common is that attitude and how often are you hearing these kinds of concerns in our community?
Well, I think it's that first of all, for people who are concerned about the delaying of the second dose, I want to say that those are the people who are really committed to get the vaccine, and that's why they wanted to make sure that they are vaccinated, which is commendable. But on the other hand, we also have to understand how the vaccine science works and how the individual benefit and the population health benefit compares when making some of these recommendations and decisions. There are certain things that obviously are unknown that we can't answer using science, and then we try to bridge that gap using the expert opinions of many experts around the world. And so it's not common, but I have heard questions, concerns from people who are basically questioning that why the second doses are delayed when the product Monograph and the company who prepared the vaccine have been pushing for the 21 days interval or 28 days interval, and what is the value and benefit to it. In an ideal world, if we don't have any shortage of vaccine supply, yes, we stick to as close to any of these guidance as possible, but in situations when we are talking about a population health benefit, when we're talking about some benefits based on the logistics, we have to make some of these recommendations and decisions, and that's how everything works. Another similar example that I can give you is the measles vaccines in children. And if you go with what these vaccines are indicated for, the first dose of measles vaccine is given to a child at the age of 12 months. And the child is eligible to receive the second dose by after 4 weeks, and we use sometime that expedited interval of measles vaccines for people who could be at a higher risk or who are traveling outside and could benefit from having like a much more robust immune response. But for the majority of the people, they get their second dose of measles at the age of either 18 months or even at 24 months. And there is no evidence to say that the first dose is not effective, and the first dose is actually pretty effective as well. The second dose basically just prolongs the duration of the immunity, and that's how most of these vaccines work. So coming back to your question, I haven't seen lots of concerns, but I did see people reaching out to me and some of my colleagues questioning the extended interval piece.
Thank you. And changing gears a bit, have you heard any complaints about a daycare operator not quarantining after travel? And are you investigating any allegations like that?
Not to my knowledge. I am not aware of that, but I can check with my team. We do review all these daycare concerns in any of the workplaces every day, and I am not aware of that, but I can definitely check with my team.
Okay, thank you. And what should someone do if they have a concern about someone not quarantining, that kind of thing?
Well, I think they can reach out to the health unit, but I think the challenge is sometimes the individual may not have all the information that when this person arrived, whether they're quarantining or are they allowed to do certain work, or if they're going out for any medical appointment or something else. So I think there are a number of nuances. We can receive that information, we can reference that, but obviously due to privacy and other reasons, we cannot confirm or say anything about those individual cases. But if there is a significant concern, and I would just say use the word very carefully, significant concern, please do let us know, and we'll have our team follow up, and we'll if it's needed, to issue any order on something, we will do that.
Thank you very much.
Any questions from Blackburn?
Yes, good morning. The data that you presented today, was that for all vaccines or a specific vaccine, or is it all combined?
This is all combined.
Do they have a breakdown that shows different, like, do they have different rates for different vaccines?
Not at this time. I think it's just because of the low sample size. It would be very difficult to do any kind of meaningful analysis if you just removed, especially the vaccine that have not been distributed. In large quantities. So 3.4 million vaccination, and majority of them being Pfizer, followed by Moderna and AstraZeneca. The numbers could be very low because I think I don't remember exactly, but I want to say close to 75 to 80% of these vaccines are Pfizer vaccine, and very limited other number of other vaccines.
Okay. Then switching gears a little bit, I noticed on the vaccine booking site that there's a category for wait list. Is this for like last minute cancellations to try to fill appointments? And are you having troubles with last minute cancellations?
So the wait list category was added recently based on the fact that previously if we had leftover doses at the end of the clinic, or if people did not show up, we wanted to make sure we didn't waste any doses, and we would be having people come in that were eligible for the vaccine. So as we have looked across all of the sites, at the end of the day, at times there are people that don't show up and there are spaces available. So the wait list is created for people to be able to just put their name on a waiting list. And if there is, as the vaccine progresses each day, if there is the ability and where we realize that there will be extra vaccine, that they would be called and have that opportunity to receive the vaccine. One of the caveats is that they have to be able to, attend the clinic within 30 minutes of the phone call, because these are, doses that are available toward the end of the day. So that's what that category is, and we're just trying to be more efficient rather than having lists. And what we would do is we would pull from some of the lists we were creating before with essential workers, and it varied. And now with the categories opening up, we've determined this. We're hoping this is a more efficient way to use the doses that are available and to contact people and have them actually, register if they want to be on a waiting list and want to get vaccinated a little ahead of time. So you'll see our waiting list is available and open to people 40 years of age and older.
I didn't notice it yesterday. Is it something new, or how has it been working so far?
So we just put it up, I believe, yesterday. So
Okay.
we don't know exactly how it's going, but we anticipate it's probably going to be fine. We'll let you know. There is a limit to how many people can register each day. So, they would have to go on and register for every day, because they are not guaranteed anything, and it's across all vaccination sites. So, there's no real, it's not where you get to choose and say, oh, I only want to be called if there's a spot available at, WFCU. It's open for any available vaccine clinic with any available vaccine at the, toward the end of the day.
So the wait list regenerates every day? So you recommend people, if they're available, to sign up every day?
I believe you have to sign up every day. Like, it doesn't carry over from day to day.
Okay. Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Do you know how many doses each pharmacy will be given of the Moderna vaccine, and when will they begin administering it?
So they will be using Moderna, and we were told that the pharmacies will probably start with 100 doses and probably per week for 3 weeks, and probably any time. We do know the Moderna shipment came and in Canada and in Ontario. And so it was announced yesterday, and I anticipate that they'll be up and running very soon. Maybe not today, but very soon. The intent was that it would start, well, today's Thursday, so start on a Thursday, but you know, we haven't had confirmation of the actual start time or date.
Okay, thank you, Teresa. And Doctor, might the 16-week period between doses shrink as a larger supply of vaccines arrives to Canada?
No, absolutely. I think that's the plan, and that's the conversation that we have already having with the province, seeing our projected vaccine supply and also what we anticipate in terms of meeting that need for the first doses and continuing with the second doses. And if we get to the point that we have extra doses available, how we can shorten the interval and use those vaccines instead of keeping those vaccines for the full duration of time. If we have more vaccine, we plan to use it to make sure that if we don't necessarily have to go to the full 16 weeks interval, and we can vaccinate people early.
Okay, thank you. Mike, I have to hop off the call now, but have a great day.
Thank you, Kelly. Any questions from Radio Canada?
Yes, good morning. We've heard from an organization that advocates for the right of farm workers that 5 migrant farm workers have passed away since March 2021. So I just want to know are you aware of that? Do you know if there is any death of farm workers in the Windsor-Essex region? So
we don't necessarily track all the deaths. If the death is attributed to COVID, then we may get notification. And so far, we haven't received any notification of a COVID-related death. And just to be clear, we don't get notified for any other type of death all time unless we actually look for it.
Okay, thank you.
Any questions from AIM 800?
Teresa, just looking for clarification on today's breakdown. I added it up and it only comes to 39 cases. You said 13 close contacts, 14 community, and 12 under investigation. That's only 39. Are we missing one?
There's one travel.
Oh, one travel related.
One travel?
Yep, sorry about that.
Is that outside of North America?
It doesn't, I don't believe so.
Yeah. It is travel to U.S.
U.S. Okay, perfect. Thank you. Teresa, going back to Maureen's question about the wait list, was there, I'm not saying a lot of doses, but was there vaccines being wasted at the end of days?
No.
No, vaccines weren't being wasted. We were just, we're finding that there's just more than usual. Early on in the first vaccine rollout, there'd be a few doses. And now if people aren't showing up or not canceling their appointment, I think that what's happening sometimes is that people are not, if they're not able to go, they're not going back onto our website to cancel their appointment. So they're still booked in the system and they may have received it elsewhere. And so we're just finding there's a little bit more. And as they monitor throughout the day, there might be, 4 or 5 people. And so nothing was being wasted. We had lists and we were calling people and bringing people in toward the end of the day. And it just became kind of an end of the day, activity that had to be completed to not waste any doses. So we're just trying to be more organized and have a process in place that will work and be meet the needs of the nurses doing the vaccine, the municipal people that are supporting the sites, and also the people who are waiting for their vaccination shot. And so if someone puts themselves on the waiting list, they're aware and they're, anticipating the call for that day. And if it doesn't come, then they'll have to, then it didn't come. But if there are doses, they'll be able to, have that opportunity to get vaccinated.
And for the wait list, like you mentioned in your first comment, Maureen, this is just for eligible individuals. So basically 18 and over in the postal codes, hot zones, and then 50 and over, plus all the essential workers that are currently eligible.
So the waiting list, it identifies people 40 years of age and older. So they're actually in the next general category for the general population. So they're not currently on any, eligible unless they're living in a hotspot already. But so this is opened across all of the sites, and it's 40. So you have to be 40 years of age or older to be on the waiting list. So it's not for anyone younger than that.
Okay, thank you. And one quick question about the pharmacies, the Moderna. Those 14 pharmacies, are they pharmacies that are already doing the AstraZeneca, or these will be new pharmacies?
So these are all pharmacies that we've had experience with before in other rollouts with the vaccine, which would be AstraZeneca. And so they are specifically going to be using Moderna, which is a new vaccine for them, but it'll move very well in the pharmacies and in the hotspot areas. So in each hotspot postal code kind of area, there are up to 2 pharmacies. I think one hotspot might have 3, but 2 pharmacies in each of the hotspot postal code areas.
Thank you.
Any additional questions from CTV?
Yes, just one more. Do you know if there's been any blood clot cases in Windsor-Essex residents associated with vaccines?
And not to my knowledge, nothing has been reported yet.
Okay, thank you.
Any additional questions from CBC?
Yes, just want to clarify something from yesterday. I know teachers and school staff are eligible under that essential workers category, but they're still eligible even though they're not teaching students in person. Is that correct?
Yes, that is correct. So the idea was to make sure that people, at least who are teaching in person, recognizing that most of the schools are online at this time, but all the educators at this time and all the categories, we preferentially we definitely want the people to get vaccinated, those who are teaching in person, but it is open for everyone in that category.
Thank you.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from Radio Canada?
No, thank you.
Any additional questions from AMA 100?
No, thank you. Have a good day.
Thank you, everyone.